How do atypical antipsychotics affect motivation and pleasure in schizophrenia? Have you ever wondered how certain medications can influence feelings of motivation and pleasure in individuals with schizophrenia? This is a fascinating topic that connects the dots between brain chemistry and mental health. Atypical antipsychotics play a significant role in this area, primarily by affecting neurotransmitters in the brain. In schizophrenia, the brain's dopamine pathways are often disrupted. Dopamine is a neurotransmitter that is essential for motivation and the experience of pleasure. In many cases, the mesolimbic dopamine pathway becomes overactive, leading to positive symptoms like hallucinations and delusions. Atypical antipsychotics work by blocking dopamine D2 receptors in this pathway, which helps reduce these symptoms. However, dopamine is also crucial in another pathway known as the mesocortical pathway. This pathway is linked to motivation and reward processing. In schizophrenia, dopamine activity in this area is often reduced, contributing to negative symptoms such as lack of motivation, known as avolition, and diminished pleasure, referred to as anhedonia. When atypical antipsychotics block D2 receptors, they can sometimes worsen these negative symptoms. This is because they further reduce dopamine signaling in areas where it is already low. As a result, individuals may find it even harder to feel motivated or experience pleasure. Interestingly, atypical antipsychotics also block serotonin 5-HT2A receptors. This action can help balance dopamine activity and may alleviate some of the negative effects on motivation and pleasure. By doing this, these medications can improve dopamine releases in certain brain areas, which might help counteract some negative symptoms more effectively than older typical antipsychotics. Different atypical antipsychotics have varying effects based on their receptor affinity profiles. For example, clozapine and quetiapine have lower affinity for D2 receptors but higher antagonism at 5-HT2A receptors. This difference may explain why they can have better effects on negative symptoms and fewer motor side effects. Another interesting concept is the fast-off theory. This theory suggests that some atypical antipsychotics bind to D2 receptors temporarily. This allows for more normal dopamine signaling, which may lessen the impact on motivation and pleasure. Despite these potential benefits, many atypical antipsychotics still carry the risk of reducing motivation and pleasure due to their dopamine-blocking effects. This can lead to the persistence or worsening of negative symptoms in some patients. Clinicians often have to balance the reduction of positive symptoms with the potential impact on motivation and pleasure when prescribing these medications. In summary, atypical antipsychotics reduce positive symptoms by blocking dopamine D2 receptors but may impair motivation and pleasure by further decreasing dopamine activity in reward-related pathways. Their action on serotonin receptors helps to offset some of these effects, making them more favorable than typical antipsychotics. However, challenges related to motivation and pleasure remain significant in treatment.